So the book I've been reading is called Cognitive Behavioral Therapy in 7 Weeks. And there were some things in it that I was reading today that I wanted to share with you. So let me just show you the book here. The book. And just some interesting little facts they had in here. Depression by the numbers. Depression is the number one cause of disability according to the World Health Organization. About 350 million people worldwide are depressed. That's a lot of miserable people. As many as 25% of people in the United States will experience major depression in their lifetime. I did not know it was that high. As with anxiety disorders, women have about a 70% greater risk for depression compared to men. And younger generations are more likely to experience depression than their ancestors. That I'm not entirely sure I understand what they're saying. Like, more recent generations now, or as in like this wasn't as common years ago? I don't know. Another thing they mention is the average bout of major depression is about 4 months. And I was reading this, so they were talking about the different types of depression. And so I have major depressive disorder, which is most common. And I think that, and I know I've mentioned this before, that it always bothered me that no one ever told me that it lifts. Like, when I'm depressed, or when I've had a depressive episode, I just thought this is where I was going to stay. And I never, I'm trying to remember when it was. At some point, someone said, oh yeah, but it'll lift, And maybe that's logical to someone else, but to me it wasn't. I just thought the way I was feeling that day was the way I was always going to feel. So it is a good reminder that these are episodes. And even if we've had, I have treatment-resistant depression, so I'm always going to have depression to some degree, but I'm not always going to have it to the degree I have it today. So I think it's a good reminder that even when you feel awful, like at your absolute worst, that you're not always going to feel at your absolute worst. It's going to let up at some point. So that was interesting. I did not know it's usually about 4 months. So, but this book is pretty, it's pretty good so far. And, I'm only a couple chapters in. Of course, they talk about, physical manifestations of depression and, about, appetite and sleep changes. And the interesting thing is about slower healing, that the body actually heals slower while you're depressed. So obviously, the brain and body are very much connected. And your body knows when you're depressed. So, but just a few things I wanted to share with you from that book. It's, I've been trying to get through it, and I've been having some trouble with focus. So today, again, I went to the bookstore, which I keep going to the bookstore saying I'm going to focus. And then sometimes I'll get there and I'll, drift off into something else or get sucked into my phone or start looking at other books. But today I was actually able to focus and get some reading done. Today isn't as good of a day as yesterday, but that's the way that depression goes. Never quite sure how it's going to be, but I'm grateful that yesterday was a good day, and or at least a better day than my days have been lately. And I did start the light box again. That did come in, and I've started using that. And so I'm trying different things to see what's going to help me, and tomorrow is my appointment with the psychiatrist to see where we go from here. And I think it will be another round of TMS and probably a new drug again. But I am going to keep trying even when I don't want to try anymore. And there are many days and many periods of my life I have not wanted to bother trying anymore because it's exhausting, it's expensive, sometimes it makes you sick, sometimes it makes you dissociate depending on what it is you did, ECT or what have you. Because all these treatments, remember, are playing with your mind. We're not healing toenail fungus here. We're trying to heal our brains. So, comes with side effects sometimes, you know. But I'm gonna keep going, and I hope you keep going too. And I'll be here every day. Hopefully TikTok doesn't go away, but if it does go away, I'll be on YouTube, but I'll be somewhere. I will be somewhere every day. In the meantime, I will be here, and hang on, because we're going to get through it together, okay?